Hi everyone, welcome back. We are now into part 4 of the series all about screen time, blue light, and how those both relate to your health. If you are joining us for the first time, welcome. I'm so glad you're here. Also be sure to check out the prior videos in the series so you're up to speed in terms of the detailed content that we're talking about here. You can find those videos through IGTV and through my YouTube channel. So before we get into that, I do want to mention again about that follow along freebie. So guys, this is a great reference to use as we go through this series. You know, it's nice to have it there to be able to jot down notes and to reflect upon it later as a reference. So again, follow that link there to grab that from the mailing list community. Also, questions and comments are very much welcomed. So throw those on out at Facebook or Instagram. So on my pages there. All right, so picking up from where we left off last time, looking at the unwanted effects blue light can pose on our sleep, melatonin production, and circadian system. So at the end of the last part, we looked at a reference to how e-reader use at night not only negatively impacted the circadian system and melatonin production, but it also reduced cognitive performance the subsequent morning. Here we once again see reference to the negative effects of nighttime blue light exposure being carried over to the next day. Here we see mentioned the negative impact on cognitive function. So diminished cognitive function the next day, impaired cognitive function the next day. Now we are going to review 3 randomized control trials. So we'll try and make this as engaging and as fun as possible. However, I recognize that it can be a bit dry. So here we go. We're just going to dive right on in. So the first study here is looking at the effects of smartphone use, and that being with and without blue light at night in healthy adults. So this study consisted of 22 healthy men between the ages of 20 and 40 years of age. And what they did was they played games on their smartphones. So either in a normal setting or with a suppressed blue light mode on. And they did that for 2.5 hours in the evening from 7:30 to 10 p.m. And as this was a crossover study, the same participants did both. So they would do the suppressed blue light mode, and then another time they would also do the regular mode, gaming on their phone for comparison. And these were the results that were found. Among the 22 participants, who were each admitted twice, use of blue light smartphones was associated with significantly decreased sleepiness and confusion, bewilderment, and increased cognition error. And so, you know, guys, cognition error is responding when nothing was elicited. So responding when you shouldn't be. And so this happened a number of times for subjects. They would respond without the presentation of a target. Also, users of blue light smartphones experienced a longer time to reach dim light melatonin onset by 50% and had increases in body temperature, serum melatonin levels, and cortisol levels, although these changes were not statistically significant. Okay, so we're seeing some trends there, but they didn't reach the level of statistical significance. And what the longer time to reach dim light melatonin onset by 50% means It's getting at later onset of melatonin secretion and lower levels. Okay, study number 2. So now we're taking a look at blue blocking glasses. In this study specifically, they were looking at the use of blue blocking glasses in major depressive disorder with sleep onset insomnia. Okay, so for those people affected by depression and having that manifest in sleep disturbance as well, troubles in falling asleep. All right, and this is what the study found. The change in sleep quality was not statistically significant. There were notable changes in individual cases in the blue blocking group, with 5 of the 10 participants showing improvement in more than 40 points on the VAS scale, which stands for Visual Analog Scale, and it's used to assess sleep quality. There were no similar marked improvements observed in the VAS scores in the placebo group. Okay, so statistical significance wasn't reached in this study, but it is speaking to noticeable changes in that blue blocking group, which were not observed in the comparison control group. And it is worth noting in this study, when you take a deeper look, there were some marginally statistically significant differences at baseline between the 2 groups. So whenever we are pursuing a research question, we want both groups to be equal and not having big differences from the get-go, right? Because those differences may account for changes that are seen. So again, ideally, even playing field when you start out. Also, 40% of participants reported pain or discomfort from the glasses, as they were only available in one size within this study. So yeah, all relevant pieces to keep in mind when we're looking at this study. Now, I also want to highlight a paper showing how blue light can affect reproductive hormones. Although not in fact a randomized control study, this 2015 study investigated blue light's effects on women's reproductive hormones. Here we see a passage from the study. I'll read it. Whilst melatonin secretion is exclusively neuronal dependent, meaning nerve dependent, it is suppressed very quickly, within 5 to 10 minutes, by blue light and is not influenced by red light or darkness. Little is known about the immediate effects of light on the reproductive hormones. So this study investigated just that. It was comprised of 16 healthy women within days 4 to 10 of their menstrual cycles. So that is the first part of the menstrual cycle, the follicular phase. 22 minutes into the light exposure, melatonin showed a statistically significant difference, that being lower in the blue light versus red group. And you'll see it here written as white light. Don't get confused. In fact, we're talking about the short wavelength blue light in that group. Also, FSH was statistically significantly different, slightly higher in the blue light versus control group. And just so you know, so FSH is a major player when it comes to regulating menstrual cycles and fertility. Okay, so that brings us to the end of this video. Be sure to catch our final episode where we wrap up the series and leave you with those practical tips and my naturopathic insight.